Again, I want to thank the county executive. I want to thank Dr. Weston. Everybody's been just great throughout all of this. And we know that the challenges are still there. I want to talk just a minute about the challenge, the national challenge, because that's clearly one of the things that's setting the stage for all this. Not only in other parts of the country, but certainly here, we continue to be in urgent need for the personal protection equipment, as well as for the testing reagents and other things to make sure that our citizens can get tested. And ultimately, the personal equipment is very, very important in the event, which I would love to say is unlikely, but is probably likely, that we're going to see an increase in hospitalization. Just this morning, we had a cabinet meeting at the city level, and both the police department, the fire department, we talked about the need for the personal protection equipment and how important this is. So I'm going to continue to urge everyone at the national level, certainly our state leaders who have been very, very good to work with, to do everything they can to make sure that we get these materials. These materials are very, very important, because when you look around the world and see which countries have been able to do this most effectively, the common denominator appears to be the quicker you can get the testing, the quicker you can get people getting the systems in the hospital, the better it will be. At the local level, as I said, we had a cabinet meeting this morning, and since then we've lifted our parking restrictions in the city. We realize that there's a lot of hardships for people right now. The handicap parking restrictions are still in place, but almost all the other parking restrictions have been lifted. So people don't have to walk long distances and they don't have to worry about that. So please refer to our Department of Public Works website to determine exactly what your situation is there. But the overriding message remains the same, and that is stay at home as much as you possibly can. The more social isolation we have, which is, I think, for some people very contrary to their essence, I think the more effective we're going to be in dealing with this issue. We know the numbers are continuing to rise. The state numbers came out today, tragically, another dramatic increase in numbers, and the numbers continue to climb here in southeastern Wisconsin as well. So there's a lot of work to be done, but I urge people to stay calm. This is a time to spend time in your homes. This is a time to, if you've ever wanted to binge watch your TV, this is your time to binge watch your TV, to clean your basement, whatever you want to do, take advantage of this. We're going to get through this.
Okay. Thank you, Mayor Barrett. This is County Clerk George Christensen. First of all, I want to commend the mayor for his hard work, and also the county executive and the emergency operations team that he has assembled for the proactive leadership they exhibited during this entire crisis. It's been really, really incredible and very helpful. Thank you. As your county clerk and the executive director of the Milwaukee County Election Commission, I manage two distinct and very important departments, the clerk's office and the office of the County Election Commission. I'll talk a little bit about the clerk's office. First of all, in order to ensure the safety of our customers and the general public, our office, the clerk's office, is going to be suspending and already has suspended all counter service, with the exception of marriage license. I still need to fulfill that state mandated and constitutional duty, and I don't expect and hope people will consider not coming in to apply to be married, but if they do, they have that right. My office will be open from 10 a.m. to 2 p.m. beginning tomorrow, and will only take marriage license applications by appointment. So I'm asking the public and the media to please refer people to our website for additional information. Second, the Election Commission, the Milwaukee County Election Commission. First of all, I want to start off by saying late in the evening of Tuesday, March 17th, I was informed that an employee that is employed with the Milwaukee County Election Commission had tested positive for COVID-19 virus. Upon notification of this event, I immediately conferred with various professionals, including but not limited to the Director of Office of Emergency Management for the county, Christine Westridge, the OEM Medical Director, Dr. Weston, the health directors from the cities of Milwaukee, Oak Creek, which is where the patient lives, and Greenfield, which is where I live, and several others, to gather information and to initiate next steps, including identify all potential employees and customers who may or may not have had contact with this individual. I also personally called every member of my staff in the clerk's office as well as the election commission. The good news is that this individual actually had not been in the courthouse since Tuesday, March 10th. She was on vacation the 10th and 11th and 12th, 11th, 12th, and 13th. She did not become symptomatic until Saturday the 14th, and she actually believes she was exposed on Thursday the 12th. Nevertheless, on Wednesday the 18th, which was yesterday, I was informed by the Oak Creek Health Director that per the state guidelines on COVID-19, that only individuals who had contact with an infected individual within 2 days of initial symptoms need to self-quarantine. Therefore, no staff from the county clerk's office nor the election commission office will put at risk, and no one else in the courthouse will put at risk as a result of this exposure and this confirmation. I'm happy to report that this individual is at home, recovering nicely, which is really what is the most important. And she is above 60, and so she was at risk, and she's doing just fine. I'm also reminding everyone that the authority and the responsibility to conduct local election results conduct local elections rests in the hands of each municipality within Milwaukee County. The Milwaukee County Elections Commission role is to provide support and to report those results. My elections director is Julietta Henry, and her entire staff has been working diligently to fulfill our role to ensure that this election runs as smoothly as possible despite these challenging times. We're continuing to monitor the situation, of course, as we know it's changing daily, and we will update the public and the media as we hear more. We've also set up a voter information hotline as part of our voter education and outreach campaign to help voters get more information. That number is 278-VOTE. Once again, 278-8683. I've also been work closely with the county executive's office and the administration to address any issues as they relate to elections. For example, the county parks facilities have been closed. However, I've worked with the county exec and the parks director. Any parks facilities that are polling places on election day will be open and fully sanitized. So there's nothing to worry about that. In addition, earlier this year, the Milwaukee County Board of Supervisors adopted a resolution, and it was signed by the county executive to allow Milwaukee County employees to be released with pay from their work assignments to train and work as poll workers. This will allow county employees who are not in high-risk groups to step in for those that may be. This is very similar to a City of Milwaukee program that we modeled it after. Thank you, Mayor Barrett. In conclusion, when the polls open or close at 8 p.m. on April 17th or April 7th on election day, we're just asking the public and the media to please be patient. Do not expect results to be rolling in 2 hours. There are so many absentee ballots that are coming in that it is going to take some time. The most important things during this election and any election is exercising your right to vote and doing so in a safe manner, having your vote counted, and having the election results reported accurately. Thank you.
Thank you, County Clerk. Dr. Weston, are you on?
I am. Can you hear me okay?
Great.
I am going to try to share my screen here. Tell me if everybody's able to see that.
Yes, we can.
Very
Got
good.
it, yeah.
So this is the new track board that Milwaukee County, specifically the Office of Emergency Management, has put together. I think it'll be a really great resource for our entire community. So to walk through it just and this will be public facing. So this will be on the website of the Milwaukee County Office of Emergency Management. In the near future, it'll be public facing, and I'll just real briefly walk through it. It's fairly self-explanatory, but you can see the total confirmed Milwaukee County cases. So this is part of my update here. So 64 confirmed cases. We do break it down by municipality. If you don't see a municipality listed, it's because there's no cases in that municipality. That'll continue to populate as more come along. On the right, we're happy that at the moment we have no confirmed deaths in Milwaukee County, but we do have the age breakdown just below that. That helps us to track the age of people who are positive for COVID, especially because it seems to have much stronger effect on the older population. And then perhaps most significant to watch is in the lower right corner there, which is the trend. And unfortunately, we do see our trend in Milwaukee County continuing to rise. We leave off the current day until tomorrow just because cases continue to be brought in to the lab and run by the lab. So we will populate the 19th today during the day tomorrow. And this will get updated continuously throughout the day. And then in the middle, you can see the map. It's reminiscent of the Johns Hopkins map. Certainly, we chose a different color, but you can see the circles will get larger as more individuals are diagnosed. Importantly, we did break this down by census region. And so the dot sits at the middle of the census. So we are certainly not identifying any individuals. And it does not lie over any individual residences or anything like that. It just sits in the middle of the census tract. And indeed, as you zoom in, the dots disappear. If somebody were to just log in and think, oh, let's see whose house that is, the dots do disappear as you scroll in. This will be, again, public facing. You can play around. There are some interesting overlays that'll become more interesting. Heat map overlays, alderman districts, supervisor districts, your health departments. And then if you scroll over the health department, it'll have their contact information. And then, of course, we're always interested in equity. And so we do have race and ethnicity information that can be overlaid as well as age and income to get a better understanding of how COVID-19 is really affecting our community. The hope here is that this map will provide resources for our, for our hospital systems, for our health departments, for our fire departments, but it will also be public facing to inform the public so they have a better understanding of what's going on in our community. That's the first update. The second update I wanted to give is based on our fire departments. So all 15 fire departments in our county are working together to organize a plan to respond to possible COVID-19 patients that engage the 911 system. This response has been geographically distributed throughout the county as a regional response plan to ensure equity among our population. We continue to work on the process to ensure a continuity of the robust, timely, and expert response to our emergent patients in need, and that will be coming out in the near future. It's continuing to be planned and finalized, but we want to ensure that our fire department is able to function effectively and efficiently. So that is my update for today. Thank you very much.
Thank you, Dr. Weston. Dr. Kowalik, are you on?
We have 41 cases right now.
Start over. You just went off of mute.
Pardon?
You just went off mute right now, so if you want to just take it from the top.
Okay.
Thank you.
Hello. The update for the city of Milwaukee is 41 cases at this point in time. Again, we continue to learn more. We get more updates on cases throughout the day. So you might see these numbers change by 9 o'clock, 10 o'clock. I also wanted to highlight our lab's productivity. Since we began testing on March 5th, we have tested 647 specimens for 587 patients. And I know lately we've seen a huge spike in numbers of specimens that have been sent to the Milwaukee Health Department lab. Yesterday, we had 115 specimens processed for 110 patients. And that's using the new criteria that the State Department of Health Services provided, that 4-tiered system, really looking at individuals that are healthcare providers or individuals that are in the hospital with COVID-19, like symptoms. Again, the symptoms for COVID-19 are flu-like. We're looking mainly for fever of 100.4 degrees Fahrenheit or higher, cough, other respiratory distress, including shortness of breath and fatigue. We also are highlighting the state's update about low-level testing or low priority testing. If someone presents with these flu-like symptoms, but they are not in the point of respiratory distress where they need emergency care, that they are to isolate for 14 days and consider themselves infected now that we have community spread of COVID-19. Another point that I wanted to update you all on is related to the state's guidance. A number of updates were provided today. One was related to updating the isolation and home monitoring or quarantine orders. So the CDC provided an update as far as clearing individuals that are patients or positive for COVID-19 of being free of symptoms for 3 days or 72 hours and not needing to take fever-reducing medication, or being free of respiratory distress or symptoms. And also looking at the time period past these symptoms, so looking at a 7-day clearance mark. Another update from the state is related to restaurants and bars, that they wanted to provide some clarity regarding takeout orders. So that information is available on the state's website, again, the State Department of Health Services. There was also some updated guidance on quarantine and self-monitoring for healthcare providers and first responders. As you know, more and more individuals that are working to keep the community safe and try to reduce the spread of COVID-19 may inadvertently be exposed to the virus through their occupation. So we're looking at individuals that are directly exposed, the duration of exposure, and determining them to be high risk, and them needing to be on a 14-day quarantine. And then individuals that have traveled, that we are looking at revising that or loosening that up a little bit now that we have community spread. So again, these updates are available on the state's website. The focus on protecting our first responders and healthcare workers is extremely important as we continue to try to suppress or flatten the curve of COVID-19 in the community. We will be focusing on doing more outreach, especially for those individuals in our community that are most at risk. Also looking at ways for us to provide outreach in a more innovative way as the health department has scaled back on many direct services aside from those that we are required to provide by law. And lastly, this update wouldn't be complete without a reminder on how to prevent COVID-19. So individual precautions, if you are under the weather, please stay home. Washing your hands for 20 seconds with soap and water. If that's not available, using alcohol sanitizer that's at least 60% or greater. Not touching your face, hands, or mouth. And then, of course, social distancing is important, the 6 feet rule that we're promoting. And also the update from the health department, as well as the state of limiting gatherings to 10 persons. So even though you may have 9 people, but making sure there's social distancing in the room, the 6 feet apart, and making sure you're cleaning and sanitizing surfaces and the Thank you.
Thanks. This is where things might start to get dicey. So if you have questions, please unmute your line. If you can't do that, I can unmute everyone, but that, as we all know, will not go well. So if you have a question, please unmute and ask it now.
Hey, Mayor, this is Derek Rose with Channel 12, and this is also for Chris Abley as well. We've seen areas like Racine County and Washington County change the way that they've handled their law enforcement face-to-face interaction with people who call 911 for service, and then their law enforcement who go respond to scenes or respond to homes. What changes specifically do we have for Milwaukee Police, Milwaukee County Sheriffs, and other law enforcement first responders in Milwaukee County when it comes to answering calls for service to 911?
This is Mayor Barrett, and again, at our cabinet meeting this morning, we discussed that with both Chief Morales and Chief Rolfing. Obviously, the police department and the fire department are going to continue to deliver the basic services to protect the health and safety of the residents of our community. What that also means, though, is things that are not as pressing are not going to be occurring as much. And to the extent that there are going to be pressures on our police department and our fire department, I think in the next day or two, what we can do is we can arrange for a public briefing from both our police chief and our fire chief so that they can go more into the specifics of what our residents can expect. But again, in terms of emergencies, we continue to want you to call if there's an emergency. I will stress, in particular for those individuals who call 911, this is not the number you call if you think you might have COVID-19. This is not the number you call. It's not an emergency response system for that. Please work with your provider. If you don't have a provider, obviously go to one of the urgent cares or use one of the other safety nets. But 911 is not there to be responding to COVID-19 calls unless they're emergency. If it's an emergency, you call the number. If it's not an emergency, you don't call the number. Again, I don't want to discourage anybody from calling 911 if it's an emergency, but I think what you'll hear our health commissioner and others say, if you have the symptoms, that may not be the time when you call that. In terms of public safety and the police, of course, if there's something that requires the police to be there immediately, do not hesitate to call. But I think it's appropriate now in the next day or two, I'll talk to the police chief and the fire chief, and we can have a session like this to talk about changes on a more mundane level, although I wouldn't say any of the work they do is mundane, so that people have a sense what to expect.
Yeah, this is County Executive Chris Abley. I was just thinking as you were saying that, Mayor, and thank you for the update, that maybe we can, having both Rolfing and Morales explain this in a session, but I can have Ernell there from the Sheriff's Department as well to just
This makes sense.
cover all this.